Hi, this is Dr. Brian Walsh, member of the research and development team with ProGrade. Cholesterol is not the evil villain that it's been made out to be by the medical community. Now, is cholesterol involved with atherosclerosis and plaque and cardiovascular disease? Yes. But knowing your total cholesterol level tells you almost nothing about your level of cardiovascular risk. So we're going to talk a little bit about some things that you can ask your doctor for, particular markers that are much better at telling you your cardiovascular risk than just total cholesterol alone. So really what we're talking about is your arteries. Now your arteries carry your blood, and arteries are made up of 3 different layers. Now plaquing of the arteries it's not like pipes that just get clogged. What actually happens is there's this whole situation of events that occurs that it gets into the walls of your artery that creates this plaquing. So that's what we're going to talk about, and we'll talk about the different things that you can actually ask your doctor for to find out your particular risk. So here's really how atherosclerosis and plaque and cardiovascular disease take place. It all starts with the innermost layer of the arteries called the endothelial lining. There's some kind of damage that takes place. Now this could be caused by things like hypertension or high blood pressure, smoking, or even just inflammation. But if you have damage, what happens is the LDL cholesterol, also known as the bad cholesterol, which is a misnomer, enters into the walls of the artery. Now, the first problem is when this LDL becomes oxidized. And when you hear oxidation, what you want to think of is rusting metal, or if you take a bite of an apple and it starts to become brown. So LDL by itself is not bad. But when LDL becomes oxidized, that creates this whole chain of events that causes atherosclerosis. Oxidized LDL, because it is inflammatory, basically calls your immune system to send certain cells called monocytes into that same area where they turn into macrophages and gobble up, literally, these oxidized LDL molecules. Again, because these are highly reactive. These macrophages, after they eat enough of the oxidized LDL, turn into what are called foam cells, because on appearance they look sort of foamy on the inside. These macrophages and foam cells secrete a number of highly inflammatory compounds like reactive oxygen species, cytokines, tissue factor, which really accelerates this whole process even more, brings more immune system molecules to the area, and brings the sticky part of your blood called platelets around to help sort of clump up this whole area as well. Then what ultimately happens, and where we get atherosclerosis and plaquing, is these foam cells start to die. And when they die, they rupture and they release this digested fat that they have into the artery wall, which ends up calcifying. And what you have then is atherosclerotic plaque that is calcification of fat, of cholesterol, and these dead now foam cells. And this is the situation. Now, obviously, when you have atherosclerosis, this will reduce blood flow to certain areas like your heart, possibly reducing oxygen to it and causing something like a heart attack. This can also become dislodged and get stuck in another part of your body like your brain and cause a stroke. So this atherosclerotic plaque is a major contributor to cardiovascular disease. But here's what you really need to know about this. One is you can ask your doctor for what is called the oxidized LDL. Not all LDL is bad. It's when it becomes oxidized that this is really when the problems start beginning. You can ask your doctor to run your oxidized LDL. The higher the amount of oxidized LDL you have, the greater risk you are for atherosclerosis and cardiovascular disease. The lower the level, obviously the less likely you are for cardiovascular disease. But here's the other thing. LDL cholesterol is not all the same size. On one end of the spectrum, you have what are called small, dense LDL particles. And on the other end, you have what are called large, buoyant LDL particles. This is important because the smaller, more dense LDL particles you have, one is they're more prone to oxidation and setting up the situation. Two, the smaller they are, the more likely they are to be able to get inside of your arterial walls to create this situation. On the other hand, you have large, buoyant LDL molecules. These are less prone to oxidation and, because of their size, are less likely to actually get in and cause this situation. You can run in blood work the particle size of your LDL. Total cholesterol is not a big deal, and it doesn't tell you how much of a cardiovascular risk you have. If you know your oxidized LDL level and the particle size of your cholesterol, that will tell you far more information. If you have high oxidized LDL and more small, dense LDL, you are at risk for cardiovascular disease. Now, one other thing to point out is omega-3 fatty acids, EPA and DHA, have been shown to, one, reduce the amount of oxidized LDL you have, and 2, actually increase the particle size of the LDL cholesterol to that of the large buoyant. So I hope you found this video helpful, and thank you very much for your time.